Welcome to this educational program. This module discusses understanding bladder infections in women, including some background information as to how infections occur and how they can be prevented. A second module is available that discusses in detail how they can be treated. This information is taken from a recent review of the medical literature and attempts to be as comprehensive as possible. However, it may not necessarily reflect the experience of your healthcare provider or the specifics of your situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Please feel free to view this presentation as many times as necessary. You may also use the player or the menu items to repeat slides or to skip through them in any order you wish. This drawing shows the key parts of the female urinary tract. Urine is produced in the kidneys and drains to the bladder through tubes called the ureters. The bladder functions to store urine and must regularly and completely empty when full. Urine passes out of the body from the bladder through another tube called the urethra. A urinary tract infection, or UTI, is simply that, an infection involving any part of the urinary tract. Specifically, these infections may be referred to as a kidney infection, called pyelonephritis, a bladder infection, or cystitis, or a urethral infection, called urethritis. Bladder infections are very common. Approximately 5% of all women per year experience one, and by age 24, at least 1 in 3 women have had at least one infection. Overall, for any woman in her lifetime, there is a 50% chance of experiencing at least one bladder infection. While bladder infections are more common in young, sexually active women, they can occur at any age. Bladder infections have a bad habit of occurring more than once. Without treatment, most bladder infections will clear themselves. However, 50% of such infections will occur again later. Even when treated, 20% of infections will recur. With all of this in mind, it is easy to see why bladder infections are one of the most common reasons why women visit a doctor's office. In the United States, bladder infections account for 650,000 doctor visits per year and 270,000 urologist visits per year. More than $25.5 billion is spent on treating UTIs every year in the United States. So why is it that women are so much more prone to bladder infections than men? This can be explained mostly by differences in anatomy. The female urethra, or urine channel, is short and straight, allowing easy travel for bacteria, or germs, into the bladder. The opening to the female urethra is also close to the vagina and anus, where many bacteria normally live. Furthermore, sexual activity may act to bring these bacteria close to the opening of the urinary tract, and certain ones can cling onto the lining of the urinary tract and travel into the bladder. It should be pointed out here, however, that bladder infections are not transmitted through sexual activity. Thus, they are not considered a sexually transmitted disease, or STD. An STD is an infection, such as chlamydia or gonorrhea, that is transmitted from one person to his or her partner through sexual activity. With bladder infections, the bacteria are already present in the woman's body, and sexual activity just brings these organisms closer to the urinary opening. Bladder infections are only caused by specific bacteria that can cling onto the surface of the urinary tract and travel into the bladder. If they are not cleared immediately, they will multiply in the bladder and cause infection. The body's reaction to this infection is called inflammation, and it is this inflammation that causes the symptoms that are felt, such as pain, frequent urination, and urgency. We have many natural defenses against bladder infections, including normal bladder emptying, which must be complete and regular. Also, women have a normal collection or flora of organisms in the vagina, which do not cause bladder infections because they cannot cling onto the lining of the urinary tract. These bacteria act to suppress the growth of the bacteria which can cause bladder infections, so their presence is very helpful. The growth of these organisms depends on the tissues in the vagina being healthy, and this at least partly depends on the presence of estrogen. Proper basic hygiene and cleanliness, of course, also helps to prevent bladder infections. With this background in mind, let's examine some of the ways in which bladder infections might be prevented. We will examine healthy bladder habits, hygiene, sexual practices, the role of estrogen, and probiotics. While we encourage practicing all of these methods, please keep in mind that in fact very few have been proven to be effective in clinical studies. Let us first discuss some very basic habits which are healthy for everyone's bladders. Drinking at least 6 to 8 glasses of water or non-caffeinated fluids per day ensures that we are well hydrated and that we fill our bladder regularly. It also prevents the urine from getting too concentrated, which may be irritative to the bladder. We must also take care to empty our bladder as completely as possible. The key to this is to completely relax the pelvic floor and sphincter muscle or valve at the start of urination. In order to completely empty the bladder, we must maintain this relaxation during the entire flow of urine. If necessary, take extra time to ensure that you empty completely. Relax and breathe slowly. Avoid straining to urinate whenever possible. Dysfunctional voiding is a term we use to describe patients who have poor coordination between their bladder and their sphincter or urinary valve muscle. In other words, when these patients are trying to urinate and contracting their bladder muscle, their valve muscle is also contracting and resisting the urine flow. There are different reasons why this might develop, but for many, it probably arises because the body remembers that it hurt to urinate during a bladder infection. Even after the infection is gone, the valve muscle tightens up during urination in anticipation of pain, just like we flinch before being hit, even if it is only a soft blow. This problem can set up an unfortunate vicious circle of events. By not relaxing completely during urination, the sphincter, or valve, does not allow the bladder to empty completely. This, in turn, can lead to another infection, and the symptoms of the infection only worsen the problem of the valve muscle not relaxing. On top of all of this, when the valve muscle does not relax completely, the bladder has to work harder to empty, and this creates an irritated bladder, which feels like an infected bladder, even when there's no infection. To avoid getting into this cycle, take care to drink plenty of fluids and relax as best as possible when urinating to completely empty the bladder. It is always stressed that women should wear clean cotton underwear and should wipe from front to back after using the toilet to prevent bladder infections. Interestingly, these simple measures have never actually been proven to lower the risk of infection in clinical studies. Please note the importance of several good sexual practices to help avoid bladder infections. Women should urinate before and after intercourse. The use of vaginal lubricants may be helpful, but diaphragms, vaginal douches, and spermicides, which are contained in some condoms, should be avoided. Many of these points, especially the role of diaphragms and spermicides, have been proven in scientific studies. Estrogen is a hormone, mostly produced by the ovaries, which has multiple roles in women. Among other things, estrogen improves blood flow to the tissues in the vagina and urethra, making them healthier. It also changes the acidity of these tissues and promotes the growth of the so-called good bacteria, which suppress the growth of the bad ones. Estrogen can be given as a pill, although routine use of this form is no longer recommended for all women. This issue can be further discussed with your doctor. Topical estrogen, where estrogen is applied directly onto the tissues, is the more commonly used form today. Topical estrogen is recommended when your doctor can see evidence that lack of estrogen is making the tissues weak or thin. There are 3 forms of topical estrogen: creams such as Premarin cream, vaginal suppositories or tablets such as Vagifem, and pessaries such as Estring. The usefulness of estrogen in helping to prevent bladder infections in women who are deficient of estrogen has been proven. There are many natural foods and supplements touted to prevent or treat bladder infections, the most famous of which are cranberry and vitamin C. Cranberry can be taken in 2 forms, pills and juice. Pills contain pure cranberry extract and are the easiest to take. To gain the benefit of cranberry through the juice form, the pure juice and not a cocktail must be taken. The main disadvantage of the juice form is the added calories you consume. Cranberry is thought to help prevent bladder infections by preventing bacteria from sticking to the lining of the urinary tract. Along with the calories in the juice form, the other main disadvantage to cranberry use is the cost. Unfortunately, we still do not have definitive proof that the use of cranberry will reduce the risk of bladder infections. Having said this, many women do report having less infections while on cranberry products. It should be noted that drinking excessive amounts of cranberry juice can cause symptoms of frequent urination, burning with urination, and even pain over the bladder, so caution must be exercised. Vitamin C has previously been touted as a simple way to help prevent bladder infections by making the urine more acidic. Unfortunately, it has been shown that vitamin C cannot actually make the urine acidic enough to be successful in preventing infections. It is also expensive, and therefore it is not routinely recommended. The usefulness of vitamin C in helping to prevent the risk of bladder infections in women has not been proven. Probiotics are gaining widespread popularity in the health food market as a natural means of preventing and treating disease. Probiotics are living microorganisms which have a benefit to the host. The most common example of a probiotic is the organism Lactobacillus, which is found in yogurt. Prebiotics are compounds like sugars, for example, which aid the growth of these microorganisms. And synbiotics are a combination of the two, with yogurt being an example. Despite the widespread global use of probiotics and the millions and millions of dollars spent on them, we are only now just beginning to properly study these agents to determine exactly which organisms, given in which form, for which conditions, are truly beneficial. In trying to prevent bladder infections, probiotics can be given in different forms. By mouth, they can be taken as a pill, or in the form of yogurt. They can be given vaginally as well, in the form of a douche. The idea behind this therapy is that these agents will promote the growth of the good germs in the vagina to suppress the growth of the bad germs. The major problem with probiotics at this point is that we do not yet know for certain what is the best organism to use and how to best deliver it. Oral forms, like yogurt, also involve the ingestion of extra calories, and vaginal forms can be very messy. These agents are also very expensive. Although we are just now gaining some evidence to support the use of certain probiotics in the prevention of bladder infections, unfortunately, nothing presently on the market has been proven effective. Although vaccinations for bladder infection are not currently available, researchers are investigating this possibility. Vaccines in development include injections as well as oral medications or pills. Another method being considered for women is the use of vaginal suppositories. Researchers are still testing which methods produce the greatest treatment outcome, but early tests do indicate that these vaccines help build up natural infection-fighting mechanisms. Most bladder infections are easy to recognize. Women experience the sudden onset of frequent, painful urination and have strong urges to urinate. The urine may be foul-smelling, cloudy, or even bloody. The presence of fever, back pain, and vomiting may suggest that the infection has spread to the kidney. In these cases, you should seek medical help right away. For most women, the symptoms alone are enough to know that a bladder infection has developed. To confirm this, a urine dip test is usually done in the office, and urine may also be sent to the lab. A urinalysis is a detailed look at the contents of the urine under a microscope. A urine culture is done to determine the exact organism that is causing the infection, and exactly which antibiotics that bacteria will be sensitive to. A sample of urine is incubated in the lab to grow the organism and identify it. It usually takes 2 to 3 days to identify a bacterium and determine which antibiotics will be effective against it. There are many conditions with symptoms that are similar to a bladder infection, a few of which we will discuss in more detail. These include resolving bladder infection, dysfunctional voiding, overactive bladder, bladder cancer, interstitial cystitis, kidney stone, bladder stone, endometriosis, radiation, eosinophilic cystitis, bladder obstruction, and urethritis. Sometimes, even when all the bacteria have cleared from the bladder, symptoms of a bladder infection, such as frequent and urgent urination, can persist. This may be due to inflammation in the wall of the bladder that goes on after the organisms are gone. If symptoms do persist after finishing your antibiotics, you should see your doctor and have your urine tested to be sure there are no more organisms or other problems in the bladder. Sometimes, medications such as anti-inflammatories and even bladder-relaxing drugs may be necessary while things settle down. Eventually, most infections subside. It is also helpful to keep your fluid intake up and to take care to empty your bladder as completely as possible. Interstitial cystitis is often confused for a number of different bladder conditions. This diagnosis is made only when all other conditions listed here can be ruled out. Interstitial cystitis may be the result of recurrent bladder infections, when the lining of the bladder breaks down and allows inflammation to settle into the wall of the bladder. It is characterized by frequent urination, both day and night, a constant sense of the urge to urinate, and pain with bladder filling. Interstitial cystitis is discussed in detail in a separate module. The treatment of bladder infections is also discussed in a separate module. Briefly, treatment includes measures aimed at clearing the actual organism causing the infection, along with measures to relieve the symptoms of infection. The mainstay of treatment to clear the infecting organism is antibiotic medication. This should be started as soon as possible after the onset of symptoms, and it is important to choose an appropriate drug and take it for an appropriate duration, as outlined in the next module. Also important is to keep well hydrated by drinking plenty of water and taking care to empty the bladder completely. Drinking plenty of water will also keep the urine dilute, which will help ease some of the irritation caused by the inflammation associated with the infection. Beyond this, there are different medications which may help relieve these symptoms, and these are also outlined in the next module. In summary, bladder infections are one type of urinary tract infection, and they are very common in women, mostly due to their unique anatomy and physiology. They have a tendency to occur more than once, especially if they are initially left untreated. Several factors may help to prevent bladder infections, including regular and complete bladder emptying, sexual practices as discussed in this presentation, and topical estrogen therapy in postmenopausal women. The effectiveness of cranberries, vitamin C, other probiotic agents, and vaccines have not been proven at this time in proper clinical trials. However, ongoing research will hopefully pave the way to more effective preventative therapies. More detailed information about the treatment of bladder infections is available in a separate module. This slide lists a few resources available where you can find more information about bladder infections. These current references were used to assist in the preparation of this module. All of these are available through your local medical library or the internet if you are interested in more detailed reading on this subject. We sincerely hope that this module has furthered your understanding of bladder infections in women. We wish you the best for the future and thank you once again for viewing this educational program.